What is up, guys? Today we are going to cover chapter 15 from the ACE Personal Trainer Manual 5th edition. Chapter 15 is all about injuries, musculoskeletal injuries. So we are going to take a look at this chapter today. So I'm sorry for being a little late. I have been off a little. I injured my eyes while doing one exercise with the resistance band, so I decided to stay away from camera for a while. That's why it became a little late, I know. One of you guys even messaged me today asking for chapter 15, so here you go. So I'm gonna show you chapter 15. I'm gonna show my personal notes, the notes that I took while studying this chapter, which I also used for revising this chapter so I have put down all the important points in a notes kind of format. So I will be teaching this chapter through my notes. I'll be showing you my notes and I'll be explaining the concepts wherever necessary. Yeah, and if you want all the notes that I'm sharing on my channel, if you want it in an easy PDF format in your mobile, if you want it available to you, all you have to do is message me on Instagram. My Instagram, you can find me on Instagram as athlete.sanju, SANJU. So you can message me there and I can send it to you either by WhatsApp or email. I can send it to you. Yeah, and of course I'll be charging a small price for that. That is not going to be free, but this is going to be free, as in whatever I'm going to show you, you can take a screenshot if you want and you can make your own notes. Feel free to do that as well. Yeah, so let's begin. So these are my notes and let's begin. Chapter 15, muscle strain. So just take a look at this. Sprain and strain. You should understand the difference between sprain and strain, because in some questions that you get in your exam, they will try to confuse you with these two things. What they will say is like, what kind of injury is this? Is this a grade 1 ligament sprain or strain? Something like that they'll ask. So in the options, they will try to use these two words interchangeably, strain and sprain. So if you don't know the difference between strain and sprain, if you get confused between these two things, then there's a very good chance that you'll get the answer wrong. Okay, so you should understand this. So for my easy understanding, I have used this is what I used, and I taught this to my friends also. So sprain, how do you remember it? SPA. Think about SPA, SPA, SPA. And I have, just for remembering sake, I have put all this. You don't have to remember it that way. Just remember, SPA is associated with ligament, and strain is the opposite of that. Like strain will be associated with muscle, sprain is associated with ligament, and strain is associated with muscle. That's the only difference. Very simple. This is the difference between sprain and strain. So why did I write this lingam spa? See, LI, like instead of ligament, I'm thinking it of as lingam. You know what lingam means, right? In India we use that word, like it's called penis basically. So lingam spa, so you go for a happy ending massage. So that's how I try to remember it, lingam spa. So ligament sprain. So that's how I try to remember this. So you can use this if you want, or you can use some other technique. So ligament is always associated with sprain. That's basically what I'm trying to say. Then again, you have the BTM and BLB. BTM means bone, tendon, muscle. So tendon is something that attaches a bone to a muscle. We know that. BLB is bone, ligament, bone. Just to remember the function of each of these, right? Tendon attaches bone to muscle and ligament attaches bone to bone. Now let's begin. Muscle strain. So there are 3 types of muscle strain. Remember again, strain is associated with muscle. Grade 1, grade 2, grade 3. In grade 1, there will be mild strain. The pain will be very mild. The muscle is going to feel very tender. And of course, there will be pain. It will be painful, but it will not be extreme. That is grade 1. Grade 2 strain, again, it is a moderate kind of strain. There will be some kind of bruising. There will be a noticeable loss of function. Meaning, let's say you have a grade 2 strain in your bicep, right? Then you will not be able to do a bicep curl. You will feel extreme pain when you try to do a bicep curl. So there will be severe pain and tenderness in the muscle. Grade 3, complete tear. There's a complete tear of the muscle. There will be swelling. These are the symptoms that you should be looking for. These are the code words. Swelling, discoloration, the color of that muscle might change. Tenderness, meaning very, like if you just touch, you're gonna feel pain. Pain is going to be severe. Complete loss of function. See, these are the code words that you should be looking for. Complete loss of function, noticeable loss of function. Getting it? This is how they'll try to confuse you in exam. They'll say that a client has this a kind of strain, he's feeling a lot of tenderness in his muscle, and he is observing a noticeable loss of function. What kind of strain is this? Right? And in the options they'll give it as grade 2 strain and grade 3 strain. So you might get confused whether you should choose grade 2 or grade 3. So that's the code word that you should be looking for. Noticeable loss of function, whereas complete loss of function. Complete loss of function would be grade 3. Noticeable loss would be grade 2. They'll also try to confuse in the options by saying giving the answer as grade 2 sprain. Instead of strain, they'll be using the word sprain. So that's when you should understand. If you don't know the difference that muscle is associated with strain and ligament is associated with sprain, if you don't know this concept, you might choose the wrong answer. That's why I told you this one in the beginning, the top one which you just saw. Moving on. One second. Let me fix this properly. Next is ligament sprain. So mostly ligament sprain happens in ankle, knee, shoulder, finger, thumb. What I've written here is thumb, and it is usually accompanied with a popping sound. You hear a popping sound followed by pain, swelling, loss of function, decreased ROM, meaning range of motion. So these are all the symptoms that you should be looking for in case you are experiencing any problem with your ligament. So ligament sprain, once again, how do you remember it? Lingam spa. So lingam goes to spa for a happy ending massage, right? So ligament is always going to be associated with sprain. Sprain is always going to be associated with ligament and not muscle. This you should remember, guys. I am repeatedly saying this because they'll try to confuse you in exam. They'll give you all the symptoms of a ligament sprain. They'll give you all the symptoms of grade 1 ligament sprain. Okay, and in the options they'll give you the answer as grade 1 strain. This is a grade 1 ligament strain. They'll say like that, and you are only going to fall for that grade 1 because you have read all these things and you'll think, oh yeah, this looks like grade 1, right? So it is grade 1, but you should read the entire thing. They'll probably say grade 1 ligament strain. In that case, you should not choose that option because ligament is always associated with sprain and not strain. And then second option may be grade 1 ligament sprain, right? So that's how they'll try to confuse you. That's why it's important to know this. Grade 1, what are the symptoms? Minimal impairment. So these are all the code words, guys. Minimal impairment, tenderness and swelling, microscopic tearing of collagen fibers. Treatment is RICE. RICE is rest, ice, compression, elevation. Grade 2. Grade 2 is a complete tear of some but not all the collagen fibers of the ligament. Possible instability. So these are all the code words you should be looking for. Decreased ROM. ROM meaning range of motion. Moderate impairment, tenderness and swelling. Treatment is RICE and physical evaluation. So if it's a grade 2, you should go for physical evaluation along with RICE. If it is just grade 1, you can treat it with simply doing RICE and that's it. Then you have grade 3. It is a complete tear or rupture. So look for these words. They'll use this word more often. Rupture. Rupture of a ligament. The moment you see this word rupture, you should understand it's a grade 3 ligament. What? Sprain and not strain. Severe impairment, swelling and tenderness, instability. Treatment is immobilization with air splint. RICE and physical evaluation. So that was just RICE and physical evaluation. Now you also have to immobilize that area with an air splint. You know the plasters that we put on your hands and stuff when you have a fracture and stuff like that, kind of like that. RICE, rest, ice, compression, elevation. So now before moving on, let me just tell you guys what are the important things that you should be looking for in this chapter. What are the important topics that you should be focusing in this chapter? Which are they? One is going to be ACL. ACL is important, guys, because ACL injuries, ACL tear is very common among clients. So again, ACE likes to test you. They want to see that whether you have knowledge about these injuries and whether you can take care of your clients better, right? Whether the clients are safe in your hands. So ACL is important. Second important is rotator cuff. Remember, rotator cuff injuries are important. Elbow tendonitis, tennis elbow, golfer's elbow, these are important. Then in leg injuries, you have the IT band syndrome. That is very important. Then what else? Lower back pain. Lower back pain and lower back injuries are also very important. So these are the topics that you should specifically focus on. Tennis elbow, ACL tear, low back injuries, rotator cuff injuries. What else? IT band syndrome. These are the things that are more important than the other topics. So let's see what ACL is. So the ACL is anterior cruciate ligament, lateral meniscus. Yeah, this is lateral so if you have any kind of lateral meniscus injury, that is associated with ACL. So now this is the primary role of an ACL. Primary role of an ACL is to prevent anterior glide of tibia away from the femur. So if this is the tibia and this is the femur, so this is your thigh bone, let's imagine, right? And this is your tibia. So anterior glide would be this, right? So if this is my femur bone, which is my thigh bone, right? This finger is my thigh bone and this is my tibia. So they are attached this way, right? Thigh, femur bone and tibia are attached this way. So anterior glide would look like this. So the tibia is coming off and it is gliding anteriorly. So this is what happens if you have an ACL tear or an ACL injury. This tibia will glide. It will come out of that femur bone and it will glide anteriorly like this. So to prevent this, you have something called ACL, which is the anterior cruciate ligament. So its primary role is to prevent anterior glide of tibia away from the femur. So the code word here is anterior glide. So remember this. So they might try to put this at posterior glide and they'll try to confuse you. So you have to choose anterior glide. So primary role of ACL is to prevent anterior glide of tibia away from the femur. Now remember one more thing, females are more susceptible to this kind of injuries. They are 2 to 10-fold greater risk of ACL tear than men because of their structure, the way they are structured, that Q shape and all that, they are more susceptible to this injury. What are the causes? Deceleration means suddenly you're trying to stop. You're running very quickly and suddenly you're trying to stop. Deceleration, suddenly you're decreasing the speed, sudden stopping, cutting, twisting, pivoting or sidestepping. These are all the places where this injury can happen, right? Like when you accidentally do something wrong while doing these exercises, or if your bones and your ligaments are not strong enough, then you can experience any kind of accident or ACL tear during these kind of movements. That's what they're saying. This is often traumatic and requires immediate medical attention. Obviously it's going to be very painful because the tibia is literally coming out and anteriorly gliding against the femur bone, which is your thigh bone. Then you have the MCL. This tear is like extremely complicated. If this happens, you generally go for surgery and stuff like that. Even ACL, it's the same thing. So this is called medial collateral ligament. I wrote here cruciate by mistake. It's collateral ligament. This is cruciate, anterior cruciate ligament. This is medial collateral ligament. Primary role to prevent knee valgus. Knee valgus, knee caving in while doing squats. We already studied that. Medial bending of the knee, on the knee. So medially means towards the middle. So this is less common and often associated with complex knee injuries where more than one tissue rupture occurs. So this is an extremely complicated injury. Causes impact to the outer knee with no twisting involved. So let's see impact to the outer knee with no twisting involved. So it is more like a mechanical injury, guys. When you have any kind of accident, you collide, that's when these kind of injuries happen mostly. Overuse conditions. So now this is done over here, it's finished. This next topic, overuse conditions. What are the overuse conditions? Like overuse injuries, basically tendinitis, bursitis. Anytime you see the word itis, it means inflammation. Remember that. Tendinitis, bursitis, fasciitis, this has to do with the fascia. What are the causes? Too much or too soon. Meaning you're getting into an exercise program and you're doing too much of that activity and too soon. Before your body is ready for it, before your body is conditioned for it, you're doing too much activity and too soon. Like people who has never done any kind of sprinting, they suddenly one fine morning they get up and they start sprinting and they do too much of it and too soon. So these kind of things can lead to injuries like tendinitis, bursitis, fasciitis, etc. So often inflammation occurs as a response to repetitive stress. That's why I said itis is always associated with swelling and inflammation. So tendinitis, bursitis, every time you see this itis kind of things, you should understand it's some kind of inflammation or swelling. Moving on, chondromalacia. So these all I have written down in points, guys. You have to just read through this. This is something you just have to kind of by heart, there's no other way. And generally they don't ask questions from these. Malacia, greater trochanteric bursitis, these are a little complicated. They generally don't ask questions from here, but still you should know, you should study for your safety side, right? Tendinitis and IT band, elbow tendinitis, golfer's elbow, these are more important. So yeah, what is chondromalacia? Basically it is softening or wearing away of a cartilage behind the patella. Patella is nothing but your knee joint. What is the cause? Posterior surface of patella is not properly tracking the femoral groove. So this is your tibia and this is your femur bone, right? So the posterior part of this tibia is not exactly properly in alignment with the groove. It is not tracking the femoral groove. That is the reason it generally happens. When it doesn't track properly, that's when this condition happens. So due to poor running style, sudden changes in running surface, suddenly you go from smooth surface to very bad surface, uneven surface, over pronation of the feet, all these things can lead to chondromalacia, this condition. Knee appears swollen and warm. Pain usually occurs behind the patella and increases when walking up or down the stairs. So these are the code words that you should remember. Pain usually occurs behind the patella, behind the knee, and it increases when you start walking up and down the stairs. So this is a condition called chondromalacia, where the posterior surface of the patella is not tracking properly against the femoral groove. Bursitis, inflammation of bursa sac due to acute trauma. Acute means that sudden trauma, during that exercise you faced some kind of trauma, some kind of pain. Repetitive stress, muscle imbalance, muscle tightness on top of the bursa, all these conditions can lead to bursitis. Commonly affects the shoulder, hip and knee. Generally bursitis is common with your shoulders, hip and knee. Then you have the fasciitis, inflammation of fascia, that is the connective tissue, commonly occurs at the bottom and back of your foot and has been linked to various intrinsic and extrinsic factors. Then you have the tendinitis. This is important. Inflammation of tendon is called as tendinitis, also referred to as tendinopathy. Some people refer to this tendinitis as tendinopathy. Commonly occurs in the elbows, shoulders, ankles and knees. Greater trochanteric bursitis. The names are complicated, I know. Painful inflammation in greater trochanteric bursa, common in female runners, skiers, ballet dancers. Prolonged running, cycling, kickboxing, these can lead to greater trochanteric bursitis. So how does it look like? How does it feel like? There will be a tingling sensation or prickling sensation, numbness, and it will be a radiating pain, radiating from the greater trochanter to posterior lateral hip. So I am also not sure about where this exactly is. I also haven't studied in depth about human anatomy. I'm planning to study that. So greater trochanter to posterior lateral hip to lateral knee. Treatment is physical therapy, ice, heat, avoiding aggressive activities. Sorry, my handwriting is very bad here. Avoiding aggressive activities, guys. So what is the exercise that you should do? You should stretch the IT band. In this case, you should stretch the IT band. Hamstrings and quads. This is a solution that generally they go for when you have this kind of condition. Strengthen the glutes and deep hip rotators. Avoid side-lying positions that compress the lateral hip. This point is very important, this particular point, because I think I got some question from here. In which condition should you avoid side-lying positions that compress the lateral hip? If they ask a question like this, then the answer is greater trochanteric bursitis. In the options, they'll probably give you this, they'll probably put this, they'll probably put that. So you have to choose this. Greater trochanteric bursitis. If you have a condition like this, if your client has a condition like this, then they should avoid side-lying positions that compress the lateral hip. Getting it? Next we have the IT band syndrome. Like I said, it is important. IT band means iliotibial band. Iliotibial band syndrome. That is what IT band syndrome means. Pain in the lateral side or outside of the knee. The lateral side of the knee, the outside part of your knee, that's where the pain occurs. Aggressive factors like downhill running, running downhill, going down a hill, stuff like that. Cycling can also trigger this kind of pain, like overuse injury. These are all overuse injuries, guys. If you just cycle, you are not going to get this injury. It's an overuse injury. Goes away with rest. So obviously if you take rest, this is going to, in most cases, it will fix itself if you just take rest. And it increases if it is not treated. If you ignore that lateral pain on the side of your knee, then this will increase. Try to regain flexibility and strength at hip and lateral thigh. So in this case, you should try to regain the flexibility and strength both at the hip and lateral thigh. Progress from 45-degree knee flexion to 90-degree flexion. So this point is important. Progress from 45-degree knee flexion to 90-degree knee flexion. They might give you a question like, this particular person has IT band syndrome. So what will be the best progression that this person must do? In the answer they'll be saying that just stop to 90-degree flexion or just do 90-degree flexion. That will be a wrong answer. The right answer would be you should progress from a 45-degree knee flexion to 90-degree flexion. So these are all code words. Then you have the patellafemoral pain syndrome. Just saying this itself is tough, I know. So what are the causes? Pes planus. Pes planus means flat foot. Pes cavus, it means high arch, excessive arch in your foot. So this is also called as runner's knee, and the pain will be usually in the anterior side of your knee, the front part of your knee. So yeah, tight hamstring. What are the causes? Flat feet, high arch in the foot, tight hamstrings and calves, weak quads and hip muscles. Hip muscles, basically they are talking also about glutes and all that, because glutes are hip extension muscles, right? Extensors. Usually there will be a pain behind or underneath the patella. Here we had seen behind the patella, right? Chondromalacia, pain usually occurs behind the patella. Here also they are saying pain occurs behind the patella as well as or underneath the patella as well. Pain when ascending or descending the stairs. So this is unfortunately the same as this, guys. Here also they said the same thing, behind the patella, and increases when walking up and down the stairs. Here also they are saying the same thing, pain behind or underneath the patella. So pain occurs when ascending or descending the stairs. I don't know why it is, but yeah, for both the cases this was the same symptom. So in this, what you need to remember is this. So these are the important points, guys, because ACE just doesn't care how much you know about patellafemoral pain syndrome, guys. They just want to know that what are the exercises that you should avoid, how to keep your client safe. In case a client comes to you with this kind of problem, you should know what this problem is, and you should know what exercise program to give, especially what exercises to avoid in order to keep them safe. That is all ACE cares about. So always keep that at the back of your mind when you're studying any chapter. So avoid deep squats, ass to grass squats. All these things you should avoid with these kind of people. Downhill running you should avoid. Prolonged sitting. Avoid open kinetic chain exercises like leg extensions. You have seen leg extensions, right, where you keep your leg on a machine and do that leg extension in that leg extension machine. These kind of exercises you should avoid. What are the exercises that you should do? Do lunges and squats. Physical therapy is required. Knee braces you may have to use. You can also stretch the hamstrings and calves, strengthen throughout the hip, knee and ankle. 45-degree mid-range of CKC means you should always do all exercises in mid-range. So see, instead of deep squats, you should be doing 45-degree squats. Getting it? Straight leg raises in supine position to challenge the quads without stressing the patella. This is one exercise this is one idea that I took from here for one of my clients. That person didn't have a patellafemoral pain syndrome, but that person had an ACL kind of problem, and I wanted to strengthen his thigh muscles, right? And because of that, I used this particular idea, this particular tactic. I made him do straight leg raises in supine position without directly stressing his knee joint. I wanted to strengthen his quads. That video is also there in my Instagram videos, I guess. Then we have the infrapatellar tendonitis. Jumper's knee. This is also called the jumper's knee. This is called as runner's knee. Remember that. Jumper's knee, pain at distal kneecap. So these are code words. Pain at distal kneecap. I know this is too much, guys. There are a lot of injuries, so many things to study in this chapter, but like I mentioned in the beginning of this video, some important topics, you should focus more on those, and these you should just learn and keep just to be safe. Yeah, so you have the jumper's knee, called as infrapatellar tendonitis. Causes are poor running style, change in training surface, avoid plyometrics. So these are the things that you should know as a trainer. Again, ACE will test you on these things. You should avoid plyometrics for these kind of people. Deep squats also you should avoid. Prolonged sitting you should avoid. Pretty much the same. Stretch the IT band. So in this case, you should stretch the IT band. Hamstrings and calves strengthen throughout hip, knee and ankle. So a lot of similarities you'll find in all of these things. That's the reason it can also be a little confusing, I understand. Shin splints. Shin splints are a little important because this is also a little common among people. I have seen a client who had this particular problem. So anterior shin splints are common in runners and military personnels. And there are two types, MTSS and anterior shin splints. MTSS is medial tibial stress syndrome. These are common in runners, dancers and military personnels. Dull ache along the distal. So all these things you can take a read, guys. So for shin splints, you should understand, this is the main point that you should understand from exam point of view and also as a trainer. That is what ACE is going to test you on. Cross training and stretching soleus and anterior compartment of the lower leg. This is the solution. So you should know the solution. You should, for these clients, you should go for cross training. So they might ask you a question like, a client has come to you and this person is experiencing shin splints. What is the best training protocol that you will be using with this client? In the options, they'll be putting as cross training and stretching soleus. So that is the right answer, right? So they'll confuse you with other options also, like make them do deep squats, plyometrics, stuff like that. So you have to use your common sense, as well as you need to know all these things, code words, cross training, stretching soleus, all these things you should know. Achilles tendonitis. This is common in gymnasts, dancers, runners. A sharp pain, they'll be experiencing a sharp pain or a burning sensation in the mornings. When they wake up in the morning, they'll experience this kind of pain in that area. Where exactly does the pain occur? 2 to 6 centimeter above the tendon insertion into the calcaneus, that is your heel, close to your heel. Ice and rest is usually the protocol that we follow. But what you need, this is the code word that you should remember. Controlled eccentric strengthening of calf complex. This line I want you to remember, guys. Even mark it. If you have my PDF, just mark this point. Just remember this point. Controlled eccentric strengthening of calf complex. Example, standing with heels, all these things you should see. Overstretching should be avoided, of course. This is common sense. Intrinsic factors, leg length discrepancies. In this case, you can go through this kind of problem. Leg length, mean one leg is longer than the others, stuff like that. Lateral ankle instability, age, pes plains and pes calvus. Again, this is flat feet and high arch in the foot. Plantar fasciitis, this is related to heel pain, inflammatory condition. So just go through all these things, guys. You can take a screenshot and maybe even make a notes of your own, or you can take my notes, which I have converted all of this into a PDF format. So you just need to walk. I don't want you to repeat the same thing again. I have also already written down in point format. Just go through it. Then you have ankle sprains. In ankle sprains, lateral or inversion ankle sprains are most common, which is typically inversion with a plantar flexed foot, medial or inversion. So all these things you can remember. What you really need to focus in this particular topic is this last point. What is the progression that you should be following with these clients? Progress with straight plane motions such as forward running, then side to side motions such as side stepping, and then multi-directional motions such as karaoke. This is given in figure 15.11, page 593. So remember, guys, they'll tell you things like, a client has come to you with ankle sprain, he has some ankle problem. So how will you progress? What is the best program design for this particular client? So in one of the answers, you will have this kind of thing, straight plane motions, forward running, then side stepping, then multi-directional motions. So you have to choose this answer. So if you don't know this properly, you will get confused. They'll give you other options and they'll try to confuse you. Here comes rotator cuff injury, very common injury. This is kind of like my specialty. I have handled a lot of clients with this kind of problem, and even I myself have had this problem. So note, strains often involve a tendon, while sprains often involve a ligament. So strains is associated with tendon and muscles. Sprains are associated with ligament. I just wrote it one more time, that's all. So these people will generally complain of a local pain at the shoulder that radiates down the arm. Could be shoulder strain or ligament sprain. It could be one of these. Now this is the important point that you should know. What is the solution? I have actually used the solution on myself as well as my clients. You should place the shoulders 30° anterior to the frontal plane. So 30° anterior to the frontal plane is called as the scapular plane. Remember this, guys. So in question they may ask you, what is the solution for someone with rotator cuff injury? So this will be the answer. You should make them do shoulder press in the scapular plane. That could be one option, which is the correct option. Or instead of that, they might say you should make the client do shoulder press at an angle that is 30° anterior to the frontal plane. So these are the code words. You should remember that. See, like I said, which is also referred to as the scapular plane. So these are the two code words. Either they'll give the answer as 30° anterior to the frontal plane, or they'll simply say make them do shoulder press in the scapular plane. So that will be the right answer. From this position, do all the exercise. Yeah. Acute injury can lead to this. Acute injury, like I said, is sudden trauma, some kind of accident that happened immediately with you, like falling on the shoulders or trying to, this had happened with me. I had gone through acute trauma. The shoulder, or trying to lift an overwhelming weight, some weight that is beyond your capacity, or trying to do a shoulder press. During that time you might go through this injury. You might get a strain or a sprain in your rotator cuff. Rotator cuff muscles, if you are feeling the pain, then it is probably a strain. Or trying to lift an weight by raising the arm. Immediate pain followed by severe loss of function. These are the symptoms. Immediately the pain will be so much that you will not be able to do anything. You'll probably just lie down and crying, Common in people under 30. This injury is most common among teenagers and young people who are below 30. Everybody is young. I mean, I'm just saying that for your understanding. Chronic injury. Chronic injury can also lead to this. What is chronic? Chronic means gradually, like repetitive stress is called chronic. Acute is sudden, like some accident like happened there. So both of these can lead to rotator cuff injuries. Gradual worsening or pain, weakness, tear in this case are a result of a degenerative process, common in people above 40. So people above 40 are more prone to chronic injuries, overuse injuries, stuff like that. Dominant arm is most susceptible for this. Like if your right shoulder is more dominant and you use it most of the time, your more chances are that your right shoulder will experience this kind of injury than your left. Males are more susceptible to this injury. Finally, there's something that males are more susceptible than females. So that is rotator cuff injuries. Males are more susceptible to this. So reaching overhead, behind the back, these are the positions that you will feel pain. When you try to reach overhead, you will feel a pain. So that is a sign that you are having some kind of rotator cuff injury or problem. Or when you're taking your hand behind the back, you will feel pain. Grabbing an object from higher shelf or putting a shirt on, all these movements will feel very difficult. So your ADL, that is your activities of daily living, will get affected if you have rotator cuff injuries. Now let's see the solution. What should you do? What is the solution? Immobilize, like put a splint or something like that, around your hand, plaster or something. Immobilize for 6 to 8 weeks. You cleared for gym activity only after 16 weeks. Build on what has been done in physical therapy. So you shouldn't try to treat this person only after they have already been treated and had gone through some physiotherapy sessions. After that, you take over. In a safe, I have written here safe, even I myself can't read it, so sorry guys. In a safe and progressive manner. Overhead activities and keeping the arm straight during exercise. So overhead activities and keeping the arm straight during exercise should be avoided, guys. Example, front raise with elbows locked out. By keeping your hand completely straight when you do a front raise, these things can trigger the pain again. So people who are recovering from this or have this injury, you should avoid these kind of exercises. So again, this point is important for you as a trainer, both for your career as well as exam perspective. Exercises with above elbows bent will create less torque on the healing muscles. So obviously when the elbows are bent, you are shortening the movement arm, right? So because of that, the stress on the muscle will be less. So for these clients, you should avoid this and you should incorporate these kind of exercises. Then we have the elbow tendonitis, very important. You have the tennis elbow and the golfer's elbow. They tend to ask these questions a lot in the exam. They'll try to confuse you between tennis elbow and golfer's elbow. So these are the code words that you should be looking for. Lateral epicondylitis, and this is medial epicondylitis. Lateral means tennis elbow, lateral means it's on the outside, right, this part of your elbow, and golfers would be in this part, your inside part of your elbow. You'll have pain, that is golfer's elbow. Tennis elbow will be on the lateral side, you'll be experiencing pain. Repetitive stress of the wrist extensor muscle. So yeah, again, this is a code word. They'll try to confuse you by putting this, instead of extensor they'll put here as flexor. So you shouldn't get confused. You should remember, if it is associated with wrist extensor muscles, then it is tennis elbow, and if it's associated with wrist flexor muscles, then it is tendons. So try to flex your this thing and see. So when you're flexing, that's when you should be feeling pain in the inner side of your elbow. So that is medial epicondylitis. So what are the symptoms? Nagging elbow pain during activities like shaking hands, handshake, turning door knobs, cooking and all that, carrying loads. All these things will trigger the pain if you have any of these two conditions. Wear wrist or elbow splints. Regain strength and flexibility in the flexor and extensor muscle groups with low weights and low repetitions. Avoid high reps, 15 to 20 reps. All these things you should avoid for these kind of clients. Also avoid locking out the elbows during front raises, the same as what we saw over here. For this also, you should not lock your elbows, you should keep a slight bend. Carpal tunnel syndrome, slightly important, they might ask you this. Narrowing of the carpal tunnel due to inflammation, eventually compressing the median nerve. I think one of my practice test, this question was asked. I'm not sure if it was asked in my practice test or was it asked in my ACE exam, I'm not sure, but this median nerve thing was asked. Like, if there's a compressing of the median nerve, or which nerve is associated with carpal tunnel syndrome, compression of which nerve can lead to carpal tunnel syndrome. The question was something like that. So median nerve, remember this. So this is common in females, especially 40 to 60, that age group. Causes are again repetitive wrist and finger flexion. Symptoms: at night or in the early morning, you might experiencing a pain or burning sensation, loss of grip. You'll not be able to hold something, it will immediately fall from your hands, dropping of objects, numbness or tingling in the palm area, thumb, index or middle finger. So these are the symptoms that you'll experience if you have carpal tunnel syndrome. Avoid full wrist this is an important topic. There's a reason I marked it, because this they might ask. Again, like I said, ACE will test you on how safe you can keep your clients. So this is the protocol that you should be using with these clients. Avoid full wrist flexion. Full wrist flexion you should avoid, or full wrist extension. Both these movements you should avoid. You should always exercise in the mid range. So basically they're saying keep a neutral grip, right? Instead of doing this or this, always keep a neutral grip. That is the mid range. Maybe slightly you can do, but don't over flex or overextend with people with this kind of problem. Finally, we have reached the last of this, lower back pain. I told you guys this is important, so study this properly. Okay, this affects 80% of the population, guys. Just imagine, among almost every client that you get might have this problem. So ACE is going to make sure that you know this concept thoroughly, that the clients are safe in their ACE certified personal trainers. That ACE will try to make sure that. So they will ask you questions from here, so make sure you know this thoroughly. Mechanical pain, DDD, that is degenerative disc disease, and sciatica, these are all related to lower back pain. So you can either experience a mechanical kind of pain due to some repetitive activity that you did, or some acute injury or chronic injury. It can also be a degenerative disc disease. It could be herniation of the disc bulging. It can be sciatica. So these are all related with low back pain. What are the risk factors? Smoking, this is big one, guys. Smoking is a very important is a very big risk factor for lower back pain. People who smoke a lot, chain smokers, they are more susceptible to lower back pain and lower back injury. Why? because there is this muscle called the erector spinae. I'm not sure about the pronunciation. Yeah, so erector spinae, that muscle relies heavily on oxygen, guys, and when you smoke a lot, the oxygen supply to these muscles are restricted, and because of that, smokers are more susceptible to lower back pain and lower back injuries. Remember this. So smoking, obesity, pregnancy, stress or depression, even depression can lead to lower back pain. I'm not sure why that is. I don't know the why behind this, but yeah, they say that stress and depression can also lead to lower back pain. Prolonged static postures, basically people doing desk jobs, right, always sitting for long hours. Mechanical pain is poor muscular strength. Because of poor muscular strength, you can experience pain. And flexibility, if you have lack of flexibility, you can experience this pain, leading to pain and decrease in activity. So when people experience these kind of pain, they'll do less activities, right, which can also make their condition worse. DDD, degenerative disc disease, intervertebral disc degenerates. It is common in ages between 30 to 50. All these things is not important, you just need to know, that's it. Bulging disc and disc herniation occurs between L4 and L5. So this is an important information. I'm not sure, I think I got this question asked somewhere. I'm not sure in my exam or in my test papers. I practiced this. So generally bulging disc, so all kind of L4 and L5 pain, L means lumbar vertebrae. So L4 and L5 pains are usually associated with a disc bulge or disc herniation, or between 5th lumbar vertebrae and 1st sacroiliac joint. So your S1, between, if the client complains of a pain between L5 and S1 or L4 and L5, then they are probably experiencing bulging disc or disc herniation. Sciatica is very important. I had 2 clients who had this issue. She always used to say, she used to feel a radiating pain and stuff like that. So pain radiates along the sciatic nerve, which run down one or both legs from the lower back. So she was feeling a radiating pain from her lower back all the way to her legs, so that kind of pain. So that is the sciatic nerve. They are experiencing pain over there. So nerves coming out of the spinal cord get pinched. That is what is happening in people with sciatica due to narrowing of outlet holes. So this is a little complicated. You need not know all these things. What they are really gonna check is if you know what this is. So they might give you something like this, pain radiates along the sciatic nerve, or pain radiates along the length of the legs, from the lower back. So what is this? What is this condition? They might ask you a recall question like that. Another symptom is pain or numbness or tingling sensation along the affected nerve. So they'll feel kind of a nerve pain, kind of like a current shock, radiating pain all the way from their lower back to their legs. Their legs might even feel numb sometimes. So in people with lower back pain or any kind of lower back injuries or lower back problems, you should avoid repeated bending and twisting. Getting it? The flexion, spine flexion, repeated bending and twisting, all those twisting exercises that you do for your obliques, those things you should avoid with people with this kind of problems. Use back support during overhead activities. Any kind of overhead presses like overhead squats or shoulder press, all these things you should use a back support. Is recommended for these kind of people who have this kind of problems. And learn how to stabilize the trunk. This is a big one. You should teach them how to engage their core properly and keep their spine neutral at all times with moderate lordosis or neutral spine. That's what I meant just now. I said the same thing. So with this, chapter is over, chapter 15. Next I'll be teaching chapter 16. So all of these notes, guys, all of these notes that I have made, I have turned them into a simple PDF. I have scanned each page and turned them into PDF, and I've put it all together in one PDF file, and I will send it to you if you want. All you have to do is message me on Instagram. My Instagram, you can find me as athlete.sanju, SANJU. Thank you for watching, guys. All the best for your exam.